This is not a new normal. This pandemic is not a new normal way of life. I can't accept that, and I don't think anyone should accept that. There will be an end to the pandemic. COVID will be with us for many decades to come, but we will not be in a pandemic mode.
This is not the time to drop your guard. And I acknowledge that for 94% of us, it may be a non-event or we'll do fine. But for 6% of us, we're going to get real sick, and for 1% of us, we're going to die.
The first positive cases of COVID-19 in Sullivan County were reported in late March of 2020. Transmission in our community remained relatively low until the summer, when the rate of new infections began to grow rapidly. As we now approach the start of the fall and winter holiday season, our region finds itself with one of the sharpest increasing rates of new cases and hospitalizations across the state of Tennessee. We spoke with Dr. Stephen May and Director Gary Mays of the Sullivan County Regional Health Department to gain some perspective on what's at stake if the spread of coronavirus goes unchecked, and to better understand if wearing masks and other measures really are effective in the fight to protect our community.
When we first spoke to you back in March, you described a number of ways to limit the spread of COVID-19, including a term that was pretty new to our vocabulary back then, in social distancing. Have these recommendations really changed since then, or are those tools pretty much the ones that are still indicated?
They're still in place, and I've moved away from using the term social distancing. We need to maintain our social connection. Just physical distancing, that magic 6 feet, is what's so helpful at preventing the spread of the disease. But the same measures worked in 1918 with the Spanish flu back then, and it works now until we have other measures in place to change the face of the disease.
From a public health perspective, how are cold and flu season going to look different this year?
It's going to be challenging because when we have co-circulating viruses that can look similar to COVID, makes it even more of a challenge. On the other hand, though, the same preventive measures that we use to prevent transmission of COVID also prevent spread of cold and flu, so we really don't know. The most important thing that we can do right now is go ahead and get your flu vaccine. That wipes one factor in many cases out of the medical decision making. Is if we've had the vaccine, we know we can protect you as a general rule, not everyone, of course. The vaccine does work, and this year is probably the most important time in our history that you should get a flu vaccine. But it makes it more difficult to diagnose. So we'll obviously be doing a lot more flu antigen screening. We're now doing COVID-19 screening, but we'll have to do those together. And we still need to practice the same measures we've talked about: isolation, quarantine, washing your hands, wearing your mask, physical distancing, to prevent transmission of all those types of viruses.
As a community and really as a region, what would you say is the biggest obstacle that we're currently facing in the battle with COVID-19?
Complacency and following the guidelines. Everybody's tired. Everybody's tired of wearing a mask. I'm tired of wearing a mask. Everybody's tired of not being able to get together. And I understand that. But this is not the time to drop your guard. This is actually the time when we really need to be most careful because we have the greatest likelihood of getting infected. And I acknowledge that for 94% of us, it may be a non-event or we'll do fine. But for 6% of us, we're going to get real sick, and for 1% of us, we're going to die. And we need to continue to protect our most vulnerable populations from exposure to this disease till we have another mitigating tool in our toolbox, i.e. the vaccine, to prevent them from getting sick with it.
One topic that a lot of folks talk about has to do with the guidance relating to the effectiveness of mask usage. That's evolved quite a bit over the course of the pandemic, ranging from being indicated mostly for strictly symptomatic individuals to now being recommended and in some cases required for just the general public. Are masks effective in stopping the transmission of COVID-19?
They're a very effective tool in decreasing the transmission. They're not 100%, but they're a very effective tool at decreasing the rates of transmission. We know that they work. There's been numerous scientific studies that back that. Unfortunately, the concept of masks have been politicized, and that is unfortunate because it is a scientific measure and tool that we know that works and helps mitigate transmission of the disease. And my response to all this is responsible people do responsible things and are caring for their neighbor. And this is not a political statement. It is just a scientific fact that if you want to help protect your neighbor, help protect your loved ones, wear a mask.
So some of the discourse we've heard from groups that are opposed to masking advocate for allowing us to build up some level of herd immunity. We've heard that term tossed around quite a bit. What would it actually take to accomplish that here in our region, and is it even feasible?
Well, when we look at the true prevalence rates, we're only dealing with about 3% of the population that's being exposed. To get any type of herd immunity, we're going to have to approach 80, 90% exposure rates. And if you'll do the math, that would just exhaust everything that we have in our healthcare system just at 6%. No pandemic has ever ended with herd immunity. We still deal with the remnants of the 1918 flu. It's the H1N1 flu that we still deal with. The only way pandemics have really been curved and turned around by herd immunity is with the use of a vaccine.
Once a vaccine is more widely available, does the threat of COVID-19 disappear? Do we not have to worry about it anymore at that point?
No, but we can attenuate its effect. Hopefully, we still deal with flu every year. We still have outbreaks of measles. We still have outbreaks of a lot of our vaccine preventable diseases. So no, it will not go away, but we may be able to keep it in such a way that we don't have to use such draconian measures to try to keep it in check and to protect our healthcare system. People say, well, why bother to protect the healthcare system? The trick is when the healthcare system is overwhelmed with COVID disease, they can't take care of the regular stuff. We still have our heart attacks. We still have our strokes. We still have those that get other pneumonias that need treatment. We still have people in car wrecks and unfortunate accidents. And if our hospitals are completely full and overrun, then we will not have the capacity to take care of much anything. So it's important that we protect the healthcare system from all those unnecessary deaths that would occur if we did not have that capacity to care for those situations.
Lastly, and perhaps separating yourself a bit from the role of physician or of a public health official, but simply just as a member of the community, what advice would you give to your friends, neighbors, and loved ones that could help all of us get back to as much of a normal as we can sooner than later?
Well, my first bit of advice is be considerate of your neighbor. Utilize the safety measures that we know that works. This will not be forever, but it's going to be longer than we anticipated or had hoped for. But when we look at the pandemic of 1918, we knew it went on for 3 years. If we have a vaccine that gets out, we can shorten a lot of that very closely. So as a neighbor, I want to say love your neighbor, practice safe techniques, and get your flu shot. till you're not transmitting these other diseases that we will see this winter. It's inevitable. It's been with us all the time. But this is the time to take care of each other. And that doesn't mean not maintaining that social connection. The social connection is actually even more important, but that we do it from a physical distance, and that we're mindful of each other and wear our mask, keep our hands washed, because right now those are the basic tools that we have in our toolbox. Once we get a vaccine, get the most vulnerable protected, then I think we can relax just a little bit. But in the meantime, we've got to take care of each other. It always comes back to love thy neighbor.
Of all the challenges that you have experienced as an agency, what would you say is the biggest challenge that you face right now related to COVID-19?
That's a very good question. The biggest challenge I believe that we have ahead of us is the virus itself and how it will spread among our community, among our citizenry. We're very concerned about that. And then the complicating factor of influenza or cold-like symptoms or allergies because they're very similar. The virus and our seasonal flu and other things going on in wintertime is very disconcerting. That we could have large volumes of what we think are symptomatic people with COVID virus or seasonal flu, and then our hospital system could be overwhelmed, and that leads to lots of other issues in our community. So that's a very real challenge that is concerning going forward. Is one, the seasonal diseases in the winter commingled with the virus itself, the hospital system being overwhelmed, and trying to communicate and keep communication flowing in a consistent way that the public can trust because we value our integrity at the lower level, and we believe our citizens trust local operations more than they do the federal or maybe even the state. So we want to make sure that we are careful in how we communicate and what we communicate to our citizens. And it's also important to educate citizenry about misinformation that's out there that's prevalent. And so there's been a lot of miscommunication and mixed messages since February. And so that's been one of our challenges, is working with our citizens and making sure they get the right information.
In Sullivan County, we've seen a lot of our numbers tied to clusters in either healthcare facilities, and of course there was a sizable number associated with the county jail at one point in time. The numbers that we're seeing now, are those elevated figures of new cases associated with those types of isolated clusters in those specific environments, or are they simply just general community transmission?
That's a fair question, and you're correct. The case rates driving higher numbers in the past were mostly attributed to facilities, long-term care facilities, or in jail, incarcerated facility, or clusters associated with events, weddings and things of that nature, just for an example. Today is very different. Today we really don't have links to large clusters or long-term care facilities. Yes, we do have cases, but the driving numbers really are from the community, families, and things of that nature. It's very different. And it's really disconcerting when we see how rapidly it's the precipitous incline of cases in the last 2 or 3 weeks, and that you really can't find a single source, if you will. It's really diffuse in the community, and so messaging like this is extremely important for us.
What's the current status and availability of COVID-19 testing through the Sullivan County Health Department?
We have really upgraded our testing capacity in the last few weeks significantly. We have increased our throughput of testing by about 200% over the last 2 weeks. So our goal is to improve our testing, encourage more citizens in Sullivan County to obtain tests. If you think you're sick or been exposed and want to get tested, please come to our health department at a drive-through. And our staff is doing a wonderful job. Very low wait times. Typically we can process someone within 10 to 20 to 30 minutes at most. And so we're very proud of that fact. Just call our number, make an appointment, and we will test anyone and everyone. And so we're very open to testing and encouraging the testing. So our testing rate in Sullivan County is improving. And the reason we want to do that is because we believe that if someone may have the disease or thinks they have the disease, if they can get tested, get their result, and they can quarantine or isolate if they're sick. Because we talk to people every day that want to do the right thing. And so the right thing is, if you're sick, stay away from everyone, take care of yourself, and don't spread the disease. And usually people, when they find out that they're a positive, they're very responsive.
You alluded earlier to the steps that people need to take are the same ones we've heard for quite a while: the social distancing, the hand washing, the mask wearing. There's a lot of people who have been trying to do that, I think, faithfully throughout the duration of this pandemic. And then you've got folks who are just eager to get back to, quote, normal as soon as possible. To those folks who are still trying to take the appropriate steps, I think there's a sense of fatigue that has set in. What would you say to those people that are feeling a little bit tired and they're wondering if those efforts are still even worth it?
Well, I'll tell you, and personally, I feel the same way. Folks are sick and tired of being sick and tired, and it's understandable. We've been through 10 months of unbelievable changing times and stress among our population, and for our citizens to hold out as long as they have, I think it's been remarkable. This is not a new normal. This pandemic is not a new normal way of life. I can't accept that, and I don't think anyone should accept that. There will be an end to the pandemic. COVID will be with us for many decades to come, but we will not be in a pandemic mode. Once we get vaccine and once we get therapeutics, we'll be able to put this behind us. But as of right now, it is a continuous, diligent effort that we must maintain as a community. And yes, most people do not get life-threatening illness from COVID, but a percentage of people do. And we have had over 40 deaths in Sullivan County, and we just do not want to have any more deaths whatsoever. And we don't want to have any more hospitalizations, and we've got to protect our hospital system. So we can't lose sight of the goal, and that is to keep our healthcare system from getting overwhelmed and protect the vulnerable population as much as possible. I understand folks are tired. They're tired of the message. They're tired of the word pandemic. But we are not going to accept this as a new normal. There will be an end to the pandemic. We have got to be diligent and think of our friends, our family, and our community moving forward. But really, the most important tools that we have in the toolbox is a message that the public, I believe, is tired of hearing. But we've got to be consistent in that folks need to use proper sanitation, washing of hands, social distancing, and wearing a mask. That's the only tools we have to mitigate the spread of this virus at this moment. The only other thing that we have is a vaccine, and that's in the future, but we don't have that right now. And so that message has got to be adhered to, especially during these winter months.
Complacency is our biggest enemy right now. Yes, we're tired. Yes, we don't want to do this anymore. But now is not the time to back off on the measures that we know that work so effectively and not to keep our families safe.